Cerebral palsy is a neurodevelopmental disorder characterized by motor and postural abnormalities that result from a non-progressive brain injury or malformation occurring in the developing fetal or infant brain. It is the most common pediatric motor disability worldwide, affecting approximately 2 to 3 per 1,000 live births. Cerebral palsy can have a significant impact on the overall well-being and quality of life of individuals, as well as on their families. In this script, we will explore the various aspects of cerebral palsy, including its neurodevelopmental abnormalities, etiological and risk factors, classification, pathophysiology, epidemiology, clinical manifestations, diagnostic evaluation, differential diagnosis, management strategies, prognosis, psychosocial impact, and the latest research advances. Let us dive into this comprehensive exploration of cerebral palsy. Cerebral palsy is primarily characterized by abnormalities in the development of movement and posture. The injury or malformation in the developing brain disrupts the normal processes of neurodevelopment, leading to impaired motor control. The specific neurodevelopmental abnormalities vary depending on the site and extent of the brain damage. In some cases, there may be damage to the corticospinal tracts, leading to spasticity or muscle stiffness. In other cases, there may be damage to the basal ganglia, resulting in athetosis or involuntary, writhing movements. Furthermore, disturbances in coordination and balance may also be observed. These neurodevelopmental abnormalities contribute to the clinical manifestations seen in individuals with cerebral palsy. The etiology of cerebral palsy is diverse and can be attributed to several factors. Prenatal factors, such as maternal infections, intrauterine growth restriction, placental abnormalities, and exposure to toxins or drugs, can increase the risk of cerebral palsy. Perinatal causes, including birth asphyxia, prematurity, low birth weight, and complications during delivery, are also significant contributors. Postnatal factors, such as infections, head trauma, and genetic abnormalities, can further contribute to the development of cerebral palsy. It is important to identify these etiological and risk factors to understand the underlying mechanisms and implement preventive measures. Cerebral palsy is classified based on the type and severity of motor impairments. The classification systems commonly used are the Gross Motor Function Classification System, GMFCS, and the Manual Ability Classification System, MACS. The GMFCS categorizes individuals into 5 levels based on their ability to perform gross motor functions, while the MACS classifies individuals into 5 levels based on their manual dexterity and hand function. These classification systems aid in treatment planning, prognosis determination, and communication between healthcare professionals. The exact pathophysiological mechanisms underlying cerebral palsy are complex and multifactorial. The brain injury or malformation disrupts normal neurodevelopmental processes, leading to abnormal neuronal connectivity, synaptogenesis, and myelination. Glial cells, such as astrocytes and oligodendrocytes, play a crucial role in supporting and modulating normal brain development. In cerebral palsy, aberrant glial cell activation, excitotoxicity, inflammation, oxidative stress, and apoptosis contribute to ongoing brain damage. Understanding the underlying pathophysiology is vital for developing targeted therapeutic interventions. Cerebral palsy has a significant global burden, with prevalence estimates ranging from 1.5 to over 4 per 1,000 live births. The prevalence varies across different populations and is influenced by various factors, including socioeconomic status, access to healthcare, maternal age, and race. Advances in medical care, including improved neonatal intensive care and perinatal interventions, have led to a decline in the overall prevalence of cerebral palsy in some regions. However, the overall impact of cerebral palsy remains substantial, necessitating continued research, early detection, and intervention strategies. The clinical manifestations of cerebral palsy are diverse and encompass a wide range of motor impairments. They can vary from mild to severe, depending on the extent and location of the brain damage. Common clinical features include abnormal muscle tone, spasticity or hypertonia, dystonia, athetosis, ataxia, and disturbances in coordination and balance. These motor impairments can affect various body parts, such as the limbs, trunk, and face, resulting in difficulties with activities of daily living, mobility, communication, and social interactions. The diagnosis of cerebral palsy is primarily clinical and relies on a comprehensive evaluation of the individual's medical history, developmental milestones, neurological examination, and neuroimaging studies. Neuroimaging techniques, including magnetic resonance imaging, MRI, play a crucial role in identifying and characterizing brain abnormalities, which aids in confirming the diagnosis and understanding the underlying structural and functional brain changes. The differential diagnosis of cerebral palsy can be challenging due to overlapping clinical features with other neurodevelopmental disorders and motor disabilities. Conditions that may need to be considered in the differential diagnosis include genetic disorders, neurodegenerative diseases, neuromuscular disorders, and sensory impairments. A thorough evaluation, including genetic testing, metabolic investigations, electromyography, and ocular assessments, may be necessary to differentiate cerebral palsy from other conditions. The management of cerebral palsy involves a multidisciplinary approach aimed at optimizing function, enhancing quality of life, and promoting independence. The treatment plan is individualized and may include physical therapy, occupational therapy, speech and language therapy, orthotic devices, assistive technology, medications, surgical interventions, and psychosocial support. Early intervention and a coordinated team approach are essential to achieve optimal outcomes. The prognosis and long-term outcomes in cerebral palsy vary widely depending on the severity and extent of the motor impairments, associated comorbidities, and access to healthcare and supportive services. While some individuals with cerebral palsy can lead independent lives and achieve functional milestones, others may require lifelong assistance and have significant physical and cognitive disabilities. Ongoing research aims to improve prognosis prediction, optimize interventions, and enhance long-term outcomes for individuals with cerebral palsy. Cerebral palsy not only impacts the affected individuals but also has significant psychosocial implications for their families. The challenges associated with caring for a child with cerebral palsy can be overwhelming and may lead to emotional distress, financial burdens, social isolation, and disruptions in family dynamics. Psychosocial support services, respite care, and educational resources are essential to assist families in coping with these challenges and promoting overall well-being. Research in the field of cerebral palsy is continuously evolving and aims to improve our understanding of the underlying mechanisms, develop novel interventions, and enhance long-term outcomes. Advances in neuroimaging techniques, genetic research, stem cell therapy, neuroprotective strategies, and assistive technologies have shown promising results. Collaborative efforts between researchers, clinicians, and families are crucial to further advance our knowledge and translate research findings into clinical practice. In conclusion, cerebral palsy is a complex neurodevelopmental disorder that affects individuals worldwide, leading to significant motor impairments and lifelong challenges. Understanding the neurodevelopmental abnormalities, etiological factors, classification, pathophysiology, epidemiology, clinical manifestations, diagnostic evaluation, management strategies, prognostic factors, psychosocial impact, and research advances is vital for optimizing care and improving outcomes for individuals with cerebral palsy. Continued research, awareness, early detection, and comprehensive multidisciplinary interventions are essential to support those with cerebral palsy and their families, ensuring they reach their full potential and lead fulfilling lives.